Dear friends and students, very good morning. In this lecture, I will be discussing about the cephalosporins. It's a group of antibiotics said to be a broad spectrum antibacterial activity, and these are all part of the beta-lactam antibiotics. Here you can see beta-lactam antibiotics includes penicillins, cephalosporins, and carbapenems. The general mechanism of action of the beta-lactam antibiotics is inhibition of the cell wall synthesis. For the synthesis of cell wall, four enzymes are required. One is alanine alanine synthetase, alanine racemase, peptidoglycan synthetase, and transpeptidase. So the cephalosporin group of antibiotics mainly inhibits the synthesis of the peptidoglycan cell wall. And this is the general structure of cephalosporins. So this is the beta-lactam moiety. The beta-lactam moiety is responsible for the antimicrobial activity. Now this is the structure of cell wall. There is a sugar strand and this is the protein which is not cross-linked. And this is the enzymes needed for the cross-linking. It is nothing but peptidoglycan synthase. Right now, this is the cross-linked proteins. Administration of the cephalosporin can able to combine with the enzyme which is needed for the cross-linking. That is nothing but peptidoglycan synthase. If there is no cross-linking, the cell wall becomes weakened. Because of the weakened cell wall, there will be changes in the osmotic pressure and osmotic imbibition of the water will take place. So more amount of water enters into the cell that leads to burst of cell. So this is a bactericidal drugs. And if you classify the cephalosporin, classification of the cephalosporin is based on the generation. The first to there are four generations of the cephalosporin. The first generation cephalosporins are cephaloxyl, cephalosporin, cephalaxin. Some of the first generation antibiotics are cephalosporins are given by oral route and some of them are given by injection. For example, cephalosporin is given by injection, whereas cephaloxyl and cephalaxin is given by oral route. The second generation cephalosporins are cephaclor, cephrosil. Both are given by oral route, whereas cephoronide, cefotiton, cefoxtin, and cefuroxime. So these four antibiotics were given by injections. If you go for third generation cephalosporin, cefdinir, ceftitoram, cefibutin, and cefixime. These four cephalosporins were given by oral route, whereas cefotaxime is given by injection. Cefotaxime proxetil, ceftizoxime, ceftazidime, and ceftriaxone. These are all other third generation cephalosporin derivatives which has to be given only in the form of injection except cefotaxime. And if you go for fourth generation cephalosporin, this is cefepime. It's only given by injection 2 grams every 8 hours. That means it has to be given 3 times a day in the form of injection 2 grams. So, fourth generation cephalosporins were available in the market. All these antibiotics inhibits the peptidoglycan synthase, which is responsible for the cross-linking in the cell wall. If you go through the therapeutic uses of cephalosporin, they are mainly used for skin and soft tissue infections and prophylaxis before surgery. preoperative care has to be given for the patients to avoid the infections or the nosocomial infections. The second generation cephalosporins were used for respiratory tract infections, acute sinusitis, otitis media, and uncomplicated urinary tract infections. Especially the cephamycins are used for skin and soft tissue infections, intra-abdominal infections, and gynecological infections. The third generation cephalosporins were less active than the first generation against gram-positive microorganism, whereas it is more active against the Enterobacteriaceae, especially the ceftazidime is used for the treatment of Pseudomonas aeruginosa infections. Third generation cephalosporins, ceftriaxone, is used for gonorrhea, Lyme disease, cefodoxime and ceftriaxone used for meningitis, ceftazidime along with aminoglycoside and antibiotics used against meningitis and also the community acquired pneumonia. Fourth generation cephalosporins are mainly used for the nosocomial infections, otherwise it is called hospital acquired infections. The fifth generation cephalosporins are mainly effective against gram-positive cocci, gram-negative microorganisms like E. coli and Pseudomonas, which is mainly used for the treatment of acute bacterial skin and skin structure infections. If you see the adverse effect of these cephalosporins, like penicillin, this may also produce a hypersensitivity reaction like anaphylaxis, bronchospasm, and urticarial. There may be chances of the cross reactivity or cross tolerance. This may also produce nephrotoxic reactions. So sometimes the antibiotics may induce colitis. If they are intolerant to alcohol, so that it produces disulfiram-like reactions. It produces thrombocytopenia and also dysfunctions in the platelets, so that there may be chances of the bleeding. Rarely, this may produce depression of the bone marrow, thereby it produces granulocytopenia. So with this, I have completed the cephalosporins, a group of beta-lactam antibiotics. In next class, we will be discussing about the macrolide antibiotics. Thank you.